Okay, hello everyone. My name is Adam Zafrani. I'm from Staten Island, New York, and my presentation is Socioeconomic Disparities in Premature Births. So I'll start the presentation off by introducing myself, then explaining the importance of global health, then giving the background of premature birth, then getting into socioeconomic and racial disparities, then the conclusion and acknowledgements. So introduction of myself. I'm currently a rising sophomore at Staten Island Technical High School. Some of my extracurriculars include I play trumpet in 5 bands. I am the secretary of TRI-M, which is a music honor society that helps run the school music department. And I'm involved in several clubs at school, one of which is designed to help plan and organize events for disabled individuals. And I'm currently enrolled in the medical school intensive at Johns Hopkins. My career plans include I want to major in either pre-med or biomedical engineering, and I intend to work in the field of biomedical science. So my connection to this presentation is that my brother and I were born prematurely at 30 weeks and 4 days. And my brother had jaundice, which is an excess of bilirubin in the blood, which causes yellow skin and eyes, and he weighed 2 pounds and 15 ounces. And I was born and I required a ventilator for 7 days and a blood transfusion. I had a very low APGAR score, which I will get into what that is on the next slide, and I weighed 3 pounds and 4 ounces. I was in the NICU for 6 weeks, which is the neonatal intensive care unit. APGAR scoring. So APGAR stands for Appearance, Pulse, Grimace, Activity, and Respiration, and is an overall measure of how healthy a baby is in the minutes following birth. So my APGAR score is around 2, and to put that into perspective, a score of around 7 to 10 is healthy. Importance to global health. So the earlier a baby is born, the higher risk of death or death or disability, and disabilities may require long-term care, which strains resources in many countries if care is even available. Premature births is the second leading cause of death in infants, accounting for about 17% of infant mortalities, and 1 in 10 births in the US are preterm. 15 million preterm births occur each year worldwide and 1.1 million deaths resulting from this. It is important to protect the health of all women and their babies throughout the world and maintain a high quality of life standard for all. What is premature birth? So premature birth can also be called preterm birth, which I will use interchangeably throughout the presentation. And the definition of preterm birth is a baby born prior to 37 weeks of gestation, and a pregnancy normally lasts 40 weeks. There are various factors that can contribute to preterm birth, which I will get into on the next slide, and there are a variety of issues that can arise from preterm births. So the main risk factors are social, medical, and behavioral. So social, teens and women over the age of 35 are at the highest risk of all age groups, and African Americans are at the highest risk of all races, and low-income individuals are at the highest risk out of the entire income spectrum due to the higher potential for bad habits and lack of accessibility to the care that they need. So medical conditions are prior preterm birth puts you at a higher predisposed risk of having another premature birth, infection, and if you're carrying multiples such as twins, triplets, quadruplets, etc. Some behavioral factors are tobacco or alcohol use, illicit substance use, or stress. Short-term complications. So breathing issues. So preemies may suffer from underdeveloped lungs, which comes from a lack of surfactant, which helps keep the alveoli in the lungs intact. So this results in the alveoli collapsing, and this is known as RDS. Heart issues. So patent ductus arteriosus is a persistent opening between the aorta and pulmonary artery, which may require surgery. And preemies may also suffer from hypotension, which is low blood pressure. Brain hemorrhages can lead to a variety of long-term complications, which I will get into on the next slide. Temperature control comes from a lack of brown fat. Gastrointestinal issues, such as necrotizing enterocolitis, can lead to the destruction of the walls of the intestines, which requires either antibiotics or surgery. Blood issues, such as anemia or jaundice, can affect premature babies. So anemia is low blood iron, and jaundice is the excess of bilirubin in the blood. And metabolic issues such as hypoglycemia, which is low blood sugar, and finally immune system deficiencies. Long-term complications include cerebral palsy, which is a brain injury that can come from brain hemorrhaging that inhibits muscle use, movement, and balance. Impaired learning, vision issues. Retinopathy of prematurity affects infants, especially premature infants, and can result in blindness at times. Hearing impairment is one of the most common issues that affects premature babies. Behavior and psychological issues such as attention, hyperactivity, anxiety, depression, somatic, and delayed development. Chronic health conditions such as diabetes, chronic pulmonary disease, hypertension, which is high blood pressure, and cardiovascular disease. And finally, they're at a high risk of SIDS, which is sudden infant death syndrome. And scientists do not know the exact causes of this, but we do know that it happens relatively sporadically, and preemies are at a higher risk. Live births by gestation period in the United States in 2018. So not preterm means 37 weeks or more. Moderately preterm means 32 to 36 weeks of completed gestation. And very preterm is before 32 weeks of gestation, which is the category that I fall into. So not preterm it accounts for 90% of the births, 8.5% is moderately preterm, and 1.6% is very preterm. And while 1.6% may not sound like a lot, on a scale of 3.8 million babies born in the United States, it's probably more than you think. So trends from previous years. So from 2007 to 2014, there was a decline in premature births, but then from 2014 to this year, it is on the rise. So as you can see in the chart, 2014, 2015, and 2016, it is on the rise in both singleton births and multiple births. And as you can also see, multiple births are at a much higher risk of having a premature baby. Prevalence by race. So as you can see on the chart on the left, non-Hispanic white is the lowest prevalence, then followed closely by Hispanic, and then non-Hispanic black is all the way at the top. And you can also see by this chart that premature births are on the rise. So in the chart on the right, it gives a few more races, and it has Asian and Pacific Islander at the lowest, and it still has black at the top. Reasons for low-income preterm birth disparities. So lack of health insurance, a lack of access to neonatal care, higher potential for bad habits such as smoking, and lack of accessibility to healthy foods. So in the key, you can see that purple has the lowest rate of premature birth, followed by blue, yellow, orange, and then red having the highest rate. So Oregon and Washington and New Hampshire and Vermont have the lowest rate of premature birth, and then Alabama, Mississippi, and Louisiana have the highest rate. So world preterm births, as you can see in the chart on the left here, this shows preterm births by percentage in each country, and the United States is ranked 131st in the world for preterm births at around 10% of births being preterm. And this is surprising because you would think that the United States, being one of the richest countries in the world, would be ranked good and more comparable to other Western nations such as in Europe. But the United States is actually ranked between poorer nations such as Timor-Leste and Thailand. And this may be accounted to the socioeconomic disparities that I talked about before, and the fact that many of the other Western countries have universal health care. In the chart on the right here, you can see the number of preterm births by country, and the United States has the sixth most number of preterm births at around 380,000. And the top 10 countries account for almost 2/3 of the world's preterm births by rank. So first is India, then China, Nigeria, Pakistan, Indonesia, United States, Bangladesh, Philippines, Democratic Republic of the Congo, and then Brazil. In conclusion, preterm births are a very important aspect of global health. Accounting for about 17% of infant deaths, preterm births are the second leading cause of death in infants. Preterm births put infants at a higher risk for other complications, which may require long-term care and strain other resources in the country. Preterm births is a widespread issue that affects the entire world. How can you get involved? You can donate time or resources to organizations like March of Dimes. You can help raise awareness in your community regarding risk factors and preventative measures. And I want to raise awareness so all preemies can overcome what my brother and I did, no matter what their socioeconomic status is. I want to start off by thanking my parents for helping me throughout my academic career. I want to thank my uncle for piquing my interest in science and research because he is a scientist. And I want to thank the Global Health Leaders Conference for this amazing opportunity. Here are my sources, and thank you all for listening. Here's my email. Feel free to reach out, and thank you, everyone.